Welcome. In this video, we'll learn about birdshot chorioretinopathy, a rare inflammatory eye disease. We'll keep things simple, calm, and classroom-friendly, using clear visuals to understand what it is, what it can feel like, and how it's usually checked and managed. Birdshot chorioretinopathy is an inflammation that mainly involves two layers in the back of the eye: the retina, which senses light, and the choroid, which is a blood-rich layer that helps nourish the retina. It can also affect nearby structures over time. Let's do a quick anatomy overview. The retina is like the eye's film or sensor, turning light into signals. Behind it sits the choroid, which supplies oxygen and nutrients. Those signals travel through the optic nerve, which carries visual information to the brain. When inflammation happens in these layers, the retina may not process light as smoothly, and the choroid may not support the retina as well as it should. Because the retina is responsible for fine detail and low-light vision, even subtle changes can matter. So why the name birdshot? In many people, the back of the eye can show multiple light-colored spots scattered across the retina and choroid. The pattern can look like tiny marks from birdshot pellets spread out over a wide area without any injury involved. Visually, you can think of it as a speckled pattern in the back of the eye. These spots are linked to inflammation, not infection, and not something you can see by looking in a mirror. They're found during an eye exam using special instruments and imaging. Birdshot chorioretinopathy is usually considered an autoimmune-related condition. That means the immune system, which normally protects you, becomes overactive in a way that targets the eye's tissues. The exact trigger isn't always known, and it's not something you caused. A key risk association is a genetic marker called HLA-A29. Many people with birdshot chorioretinopathy have this marker. Having HLA-A29 does not mean you will definitely get the disease, but it can increase the likelihood, like a risk factor rather than a guarantee. Because it's rare, many learners haven't heard of it. It often affects adults, and it can involve both eyes. The good news is that with careful monitoring and treatment aimed at controlling inflammation, many people can protect vision and maintain daily activities. Common symptoms can include blurred vision, like looking through a slightly smudged window. Some people notice trouble seeing in dim light or at night. Others may see floaters, which can look like small drifting specks or threads moving across the field of view. Night vision difficulty can be especially frustrating. You might feel that your eyes take longer to adjust when lights are turned down, or that details disappear in shadows. These changes can be subtle at first, which is why regular eye checks matter if symptoms appear. Floaters are common in many eye conditions, and they don't automatically mean something serious. In birdshot chorioretinopathy, floaters can happen because inflammation can affect the clear gel inside the eye. If floaters suddenly increase or vision changes quickly, it's important to seek care. Over time, ongoing inflammation can gradually affect how well the retina works. Some people notice slow changes in sharpness, contrast, or color perception. Without good control, inflammation can lead to longer-term damage. That's why early detection and steady follow-up are so important. How is it diagnosed? It usually starts with a detailed eye exam. An eye specialist looks at the back of the eye and checks vision in different ways. Because the changes can be subtle, imaging tests are often used to get a clearer picture of the retina and choroid. Imaging can include scans that map the retina's layers and pictures that highlight inflammation patterns. These tests help track where changes are happening and whether they're improving or worsening. The goal is to measure the disease carefully, not to overwhelm you with technical details. Management is usually focused on monitoring and controlling inflammation over the long term. The exact plan is individualized and may change over time based on symptoms and test results. The key idea is to protect the retina and maintain vision by keeping inflammation as quiet as possible. Early detection matters because treatment works best when inflammation is addressed before it causes lasting harm. Regular follow-up visits help catch changes that you might not notice day to day. If you're diagnosed, keeping appointments and reporting new symptoms promptly can make a real difference. To recap, birdshot chorioretinopathy is a rare autoimmune-related inflammation affecting the retina and choroid, often linked with HLA-A29. It can cause blurred vision, night vision trouble, and floaters. With careful diagnosis, monitoring, and inflammation control, many people can manage it well. Thanks for watching.